It is another episode of the About Mansfield Consumer Advice Series. I'm your host, Steve Casillo. We appreciate you being here today. And today in the studio, first of all, we say welcome back to an old friend. And to my right, that would be to your left, Dr. Joseph Adams with Calibration, Chiropractic, and Functional Health. First of all, welcome back.
It's good to be here, man. It's been a while, and I'm excited to get back and share some advice on your program.
Let's jump right into it. Today, and actually for the next 4 weeks, you're going to be with us for a while. And so note to the listeners, the viewers, Dr. Joseph owns a chiropractic service here in Mansfield, and he's going to be here every week for several weeks. So get ready for it. Today and for the next several weeks, we'll be talking about migraines. And actually, you know what? I before we jump into migraines, for those who don't know what chiropractic health is, if you can give maybe the elevator pitch to the listeners of what does a chiropractor do?
That's a really good question. And, the best way to answer that is that we all do something different, quite honestly. There's some core principles or tenets, to chiropractic. And really the biggest one that unites us all is that we all believe the body is capable of, healing itself given the right conditions. I'd say that's the one thing that we all have in common. But how we go about helping people heal varies on the different techniques, philosophies, and education levels of the individual chiropractors.
Okay. Let's get into migraines. Starting with Migraine 101, what is a migraine?
So a migraine disorder is actually a neurologic condition. It's a neurologic condition that you are most likely born with, meaning it's genetic. Mm-hmm. And so a person with migraines actually has a change in the ion channels in their nervous system. So ion channels are responsible for signaling nerves, to fire or to not fire, to bring them to threshold or to not to threshold, right? So it's either going to fire something off or it's going to stop something, right?
Okay.
And so people who have migraines have alterations in these ion channels, and because they have alterations in the ion channels, they have these brains that are very sensitive very much like somebody who has a seizure disorder. So you could say in a way that a migraine disorder is very similar to somebody who has a seizure disorder.
Would they be having a seizure then? I've never experienced a migraine, so I all I know is that it's like a severe headache, is it not?
Yeah, so that's the symptom of it, correct? The symptom of it is that you're going to have pain in your head. But the difference between, the seizure and the migraine is that, the symptom of the seizure is, depending on what seizure you have, is going to be like tremors, consciousness, changes in consciousness, things like that. Whereas migraine is going to be, head pain, neck pain, and some other different symptoms. But what they do have in common is something, this activity in the brain that's called cortical spreading depression, where you actually have this wave of electrical activity that starts in like the frontal portion of the brain, goes towards the back and vice versa. And you see that on fMRI scans in patients that have migraine and in patients that have seizure. So that's kind of how they're similar.
So you've got the difference between seizures and migraines. What's the difference between a migraine and just your basic headache?
So that is something that is really important to cover, because what I've noticed over the years, treating a lot of people who have head pain in general, is that a lot of people think they have migraines when they don't. Mm. And it's really common. It's crazy how many people come in and they're like, oh, I'm on all these migraine medications, or I've tried all these migraine medications. I'm like, well, you don't have migraine. You have tension type headache. And so the big difference between migraine and headache is that migraine is the, ion channel dysfunction. It's genetic. They'll have it for the rest of their life. You can only mitigate it. But people who have just regular headaches are usually, in the 40 to 60% range of those people really just have tension type headaches. And so for it to be a migraine, it has to absolutely be on one side of the head, always. Always on one side of the head. If it's not on the same location in the head, it's most likely, probably like 99%, not a migraine. it's another type of headache. And there's many different headache disorders, so it can be really complicated to tease this out. But it's got to be on one side of the head. It's got to be like throbbing, pulsatile.
Yeah.
It's got to be extreme debilitating pain. And it also is going to have a prodrome and a postdrome to it. So the cycle of pain, tension, and other problems is going to last more than just the head pain. And so that's really the big difference between somebody who has a migraine and somebody who has a headache. The headaches are going to be all over the place, anywhere in the head. Maybe they start in the neck, and they're going to be less painful, and they're going to have a less dramatic effect on the time that the person is having the head pain.
When it comes to migraines, does it just come on? Do people know that a migraine is coming on, or is it like a light switch where it's all of a sudden, boom, a word that you use, debilitating? Do migraine sufferers know that a migraine's coming on?
I would say for the most part that they do.
Okay.
Because if you are a true migrainer, and you've experienced this for a really long period, most of your life, then you've figured out the pattern.
Okay.
Right? And the pattern for some people may be that they get like tired, right? And they're like, ooh, I'm getting tired, or, and it's like an abnormal tiredness. Or they have a visual change, like they get little blurry lines, or, their vision gets a little bit darker, or it closes in, or they have spots in their vision. And those are some of the signs that you have a real migraine disorder, and that's called the prodrome, which is the stage where you're getting the cortical spreading depression in the brain, but you don't have head pain yet.
Okay. You mentioned people get migraines. Who suffers from migraines?
That's a really important component of it, because most migraineurs are females.
Really?
And so it's predominantly a disease that affects the female population. And what's really devastating about a migraine sufferer is that they're going to have migraines for the most productive and important years of their life. So think about it. Like you have migraines, they set in when you're like in your teens or so, something like that. Mm-hmm. And then, you go into your adult years and you're trying to build a career, have a family, and raise children, and be like a wife, a mother, all of these things, and you're struck with this migraine disorder through the most productive, important years of your life. And that's why the disability from migraine is much worse for those sufferers than a lot of other disabilities you could have in the world. And migraine is said to be the number 2 disability worldwide, depending on whether you're having migraines from overuse of medications. And that's one of the biggest reasons it actually is higher than we previously thought, the dysfunction, because a lot of people who are on migraine medications actually get more migraines because of mismanagement of the medications. By overusing the medications, they get more migraines.
Let's talk about management or mismanagement of the migraine as opposed to the medicine. First of all, is there a cure? And if not, how do you manage migraines?
So unfortunately, there's no cure for a migraine, right? The only time that you do see people get a cure, if you will, or something that appears to be a cure is in females when they get pregnant. A lot of times, migraines will go away. And that usually is because of a hormonal change during pregnancy. And then once they reach menopause, they're also going to have a decline in the migraine events. But besides that, it cannot be cured because it's an ion channel dysfunction that's genetic to them. And really the only thing you can do is mitigate and manage triggers so that they have less head pain days and make their quality of life better.
In the minute or so that we've got left in this 10-minute nugget of information, is there anything that you want to add to this, or if something that you want to recap in regards to migraines?
Yeah, I would just recap it, overall is that, migraine is very different from a headache. It's extremely painful. It lasts several days, and these cycles usually happen, throughout the month where, you have like 3 days of pain and problems, and then you get a little reprieve, and then you start up and you maybe get 3 or 5 days of pain and problems. And some of these people, are having, head pain days that go up into the 15, days a month, 50%, 60% of the month. And there are treatment options out there available for them that are safer and more effective than medications alone, because at times the medications cause more problems and also they are feeling hopeless because they've tried just about everything that traditional medicine has available for them. And it just breaks my heart to see that, because I know that there are other ways to improve their lives besides medication alone.
If someone wanted to reach out to Dr. Joseph Adams and get more information regarding your chiropractic health service or specifically about migraines, how can they reach out to you?
We can be found on, social media. We're on Instagram, Calibration, CFH. We're, on Facebook, Calibration, Chiropractic. You can find us on Google search, Calibration Mansfield. We're pretty much everywhere. You can reach out to any of the channels that we're on, and we'd be happy to chat with somebody about, what's going on with them and how we may be able to help them.
And you're right there on Main Street, downtown.
That's right.
Excellent. That is Dr. Joseph Adams, Calibration Chiropractic and Functional Health. You can find him again right here on Main Street in downtown Mansfield. And Dr. Joe, appreciate it. Good to see your face again. And we'll see you next week.
All right, buddy. We'll see you then.